Hi everybody, I'm Leonie Naeije for SIOP Young Investigators, and I'm meeting today recording with Sheena Mukkada. She is an instructor in the St. Jude's faculty and has a research interest in infectious disease in immunocompromised children. And she just gave us a great talk about her insights about the COVID-19 pandemic and what it means for our patients. So Sheena, thank you so much for this opportunity to have some extra questions for you. What can you tell us about the main goals of the global COVID-19 childhood cancer registry?
So first and foremost, the registry was constructed as a way to allow the global community to interact and share data and experiences in a rare disease population. The amount of experience that any one center was going to get with pediatric oncology patients was going to be so small with COVID-19 that we really realized that we needed to work together as a global community to address the challenge. So the first product really is the data visualization that is live at COVID-19childhoodcancer.org. And it is the spot where you can get the up-to-date information.
Great. And how many countries have contributed to the registry so far?
So as of, let's see, I would have to check to see what the data looks like today now that I think about it. That's a really good question. I think we have 40 countries reporting as of today.
Wow. And can people still contribute, or if they haven't enrolled yet?
Absolutely. So we're up to about 910 cases. We're keeping this registry active as long as the pandemic makes us keep the registry active. I think that the truth of the matter is I wish we could close the registry, but I don't think that we can at this point. We are getting new insights on COVID that evolve over the months. Let's say the example of the multisystem inflammatory syndrome in children is something that we could not have predicted when we started this registry. So we weren't set up to capture those data fields. Now we've modified those data fields and we'll be collecting that data. And maybe going forward, that's the type of new information that any new contributors would be able to give us to know whether we're really seeing this MIFC in pediatric oncology patients.
Oh yeah, I can imagine that would be very interesting. And which patient did you guys find to be at highest risk for severe outcome due to the COVID-19 infection?
So thus far, when we were conducting our multivariable analysis, we have found that the patients that have acute lymphoblastic leukemia and lymphoma are those that have a diagnostic group that's as high at risk for complications due to COVID or to severe infection due to COVID. We have also found that lymphopenia, specifically an absolute lymphocyte count less than 300 right now, is associated with a higher disease severity. We are actually conducting further analysis related to basically looking at cut points for ALC and perhaps even ANC to be able to determine whether there's really a cut point that distinguishes patients that have a higher risk of severe disease due to COVID. So that will be forthcoming, but is kind of secondary analysis that we did along the lines. We only have that data for certain patient populations because the way that the registry is constructed is that it's supposed to be really easy to use and not require the oncologist or the infectious diseases specialist or pediatrician or whatever to go back and look at the chart if they want to contribute. So we haven't required the absolute neutrophil count or the absolute lymphocyte count as a required data field for everyone. So we only have a subset of patients who have that information. So now we're going back and analyzing that continuous variable to be able to come up with some better answers for you in terms of who's really at risk.
Yeah, and why do you think the patients post bone marrow transplant were less infected?
So I don't think that we found that. The post bone marrow transplant patients, we just have a small number, and I think what that reflects, so it's 6% of the total population that is reporting, and I think that just may reflect which centers are contributing data. So realize that we have very low numbers of contributors from low-income countries, but we do have some low and middle-income countries who aren't really performing transplant as much. So it's really hard to comment, and because again, a registry is designed to be voluntary reporting, that one of the known limitations is going to be able to make any sort of population level conclusions. So we're not really going to be able to say of this total population of pediatric oncology patients, raw number, this many with BMTs had suffered COVID infection versus the population that didn't. We just don't know about the population in total. And I mean, anecdotally, I can tell you that there's 24 deaths in the total sample, and of those, 6 of those deaths occurred in HSCT patients. So for whatever that's worth.
Yeah, so they might be less populated in the registry. Yeah, but might be more at risk than we know at this stage.
Yeah.
And can you say anything about what you see in the last couple of weeks of the registry? Did you see where it is going? Do we see, because of all the regulations in place in different countries, that the infection rates in our kids are going down because they're already doing lockdown a little bit more than other people? Or
so we are seeing a slowdown in cases contributed. We ramped right up to that 730, which was by the time of the data freeze on August 10th. And then, as I've said, we've only gotten up to 910. Again, because I can't actually say if there are forces that make people less likely to contribute to the registry, whether it's decreasing interest, or if people knew we were putting together a publication, so everybody was doing a push before the publication to try to get on board for that. And then kind of slowed off after that. But I have gotten a couple of emails as follow-ups after this point to ask me, hey, are you guys still collecting data? So maybe I need to do better advertising to say, yes, we want you to contribute, and we want you to be a co-author, and we want you to be participating in the global academic endeavor. But we also want you to keep contributing, and this is still live because it's supposed to be a service to the community.
Oh, so this might be a good platform to state again where we can find this registry.
Yeah, so again, the registry link should be able to be found at covidchildhoodcancer.org, I believe it is. I feel really bad saying that COVID-19childhoodcancer.org, sorry, misstated.
Great. Can we find a link, or can we send you more information, more questions if we want after your presentation?
Absolutely.
Great. Great. I think that's it.
Okay. Hopefully they find something they want.
Thank you so much, and I will send this recording to SIOP, and we'll see what they cut out and use.
Well, thank you for being willing to do said interview. This is a nice. You're doing a service for the community. Look at you.
Thank you. All right. Hey, enjoy your little baby and the rest of your day.
Okay, you too.
Hopefully we meet again.
Yeah. In another world when we can actually meet post-coronavirus.
And drink coffee.
Pretty good. All right.
Bye.
Bye.